This is Dr. Wingo, and just wanted to have a preliminary brief discussion about some symptoms, signs of allergy and dry eye. Both conditions cause irritated nerve endings, which can result in itching sensations and, if a little more intense, some burning sensations. The symptom itself is not a differentiation point other than to tell you something's causing a nerve to be irritated. If you have allergies, you can get some increasing puffiness around the lids and the eyes, along with a little bit of mucus or crust developing. And blinking doesn't necessarily relieve that other than very transiently. In contrast, dry eye is often improved simply by a couple of blinks to bring some tear film down over the eye, although if an individual is making less tear film than normal, which most of us do as we get older, the symptom improvement may last a short time. The only sure way is to carefully examine both the lids, the white covering of the eye called the conjunctiva, as well as look at the corneal surface on the front of the eye. There are differentiations there that obviously help, and either of these conditions, if they persist, are not only uncomfortable, but can directly affect the vision and lead to increased risk of bacterial infections with further problems. It's important to be aware of how your eyes are feeling when you're out doing normal activities, and if you notice an itching or irritation, an immediate question should be, am I getting any nasal congestion or sinus type congestion with drainage that might indicate allergy? Also, a recent onset of a dry, hacky cough can be a sign of allergy as well. By contrast, dry eye usually affects only the eye, and the first symptom people can usually recognize is that there's a bit more of a blur in the vision, particularly for detail type things such as reading or computer work. A couple of blinks may improve it momentarily, but if one is not making enough tear fluid, it will rather quickly blur again. That can be a definite sign of a dry eye problem, which needs to be evaluated, and the treatment for either condition is to use drops to keep the eye moist and reduce the irritation around the eyes to keep the situation controlled so no infection develops. The symptoms themselves are not necessarily characteristic, as I said earlier, so you need to be careful to observe what is your vision doing. Is it blurrier than usual, and does blinking help? And are you getting any notable increase in redness or mattering, which could indicate something with more of an allergic basis? The two conditions obviously affect the same tissues and can in fact be mixed so that you have both dry eye causing irritation, which could then lead to more likelihood of allergy infection. So it's very important to be aware of how your eyes feel and how stable your vision is. And if any of the symptoms develop, be sure and get that checked to avoid further problems. That's just a preliminary introductory discussion. The details really come more with evaluation of the particular patient and what the symptoms and the signs are at that time.